Hey, I'm Nancy Cavey, National ERISA and Individual Disability Attorney. Welcome to Winning Isn't Easy. Before we get started, I've got to give you a legal disclaimer. This podcast is not legal advice. The Florida Bar Association says I have to say this, and now I've said it. But nothing will ever prevent me from giving you an easy to understand overview of the disability insurance world, the games that carriers play, and what you need to know to get the disability benefits you deserve. So off we go. Today we're going to talk about back and neck conditions, whether they are caused as a result of an injury or they are congenital. I find that these are the basis of commonplace ERISA disability claims. Now, that doesn't mean that they're easy to win. Often back and neck pain can be subjective in nature or can even be temporary. That can mean difficulty in proving your entitlement to your disability insurance benefits. So in this episode, we're going to work through a number of back and neck disorders, including symptoms and treatment, and talk about how carriers handle them and what you need to do to win your back or neck disability insurance claims. So I'm going to talk about four things today specifically. First, I'm going to talk about cervical dystonia and your ERISA disability insurance claim. I'm going to talk about how your long-term disability carrier expects you to potentially undergo certain forms of treatment for spinal stenosis. I'm also going to talk about back pain caused and lumbar radiculopathy, and whether or not that should be considered or would be considered a somatic disorder that would justify a termination of benefits. And I'm going to talk about what a positive Waddell sign in your physical examination means and how an ERISA disability carrier plan can use the results of that test to deny your ERISA disability back claim. We've got a lot to cover today, but before we do that, we're going to take a quick break. Welcome back to Winning Isn't Easy. Cervical dystonia and your ERISA long-term disability claim. Cervical dystonia is also known as spasmodic torticollis. It's a disorder that's characterized by involuntary muscle contractions in the neck that will cause abnormal movements and postures of the neck or the head. The severity will vary from individual to individual, but it can cause significant pain, discomfort, and limited range of motion because of the abnormal posture. I'm often asked, well, what are the causes of cervical dystonia? And I will tell you that there really is there's no known cause. It's classified as isolated cervical dystonia if it's not associated with any other abnormal findings such as spasticity, Parkinson's, or ataxia. There's also something called secondary cervical dystonia that can be caused by an underlying medical condition such as a degenerative brain disease, or can be secondary to the use of certain drugs like antipsychotics or nauseousness medication that will impact or blocking activity in the neurological system. So it can be two types of cervical dystonia. But what's more important in my view are the disabling signs and symptoms of cervical dystonia. And this is particularly true because the disability insurance carrier will be reviewing your medical records and wants to see in those medical records signs and symptoms that are consistent with a diagnosis and signs and symptoms that can be disabling, as that term is defined by your disability policy or plan. So what are the signs and symptoms of cervical dystonia that the disability carrier is looking for in your records? Well, there'll be a twisting of the chin towards the shoulders where the hip tips forward, and that's known as anterosclerosis. There's an abnormal posture where the head is tipped backwards, and that's known as retroscoliosis. There's also an abnormal posture where the head tips to one side, and that's known as lateral scoliosis. Now, what's important here is that the signs and symptoms all differ from individual, and it can worsen with stress or excitement. Now, it's really important, I think, that you are giving your physician a really good history of what your particular symptoms are, how they impact your ability to function, and how they may be exacerbated or even accelerated by such things as stress or excitement. Also, we want to think about the secondary problems that are caused that can also be disabling. Sometimes we will see cervical arthritis, compression of the nerve roots, even cervical stenosis. And so it's important that your medical records are documenting that, including an objective basis of that diagnosis. You probably also have pain on the same side as the head is turned, with muscular pain because of the overactive muscles, and that can in and of itself be disabling. So the question then becomes, what do disability carriers or plans look for in your medical records? Now, they're obviously looking for several things. One is they're looking for your patient history. They're looking for a clinical examination by a specialist. And I want you to remember that there isn't any specific laboratory testing, blood work, or EMG studies that will confirm the diagnosis unless you've got radiculopathy. One of the things that I always try to submit in these claims are photos or videos that illustrate not only the abnormal posture of the head, but show examples of difficulty functioning as a result of the positioning of the head. The disability carrier is also going to be looking at your medical records for treatment issues. And under the terms of most disability policies or plans, you're required to get reasonable and appropriate treatment for your medical condition. So what do they want to see in your medical records? Now, these treatment options can be used alone or in combination or in conjunction with physical therapy. So if you're getting physical therapy, we also want to make sure that your physical therapy records are documenting the objective findings that the physical therapist is noting. Also, we want to have them potentially do a range of motion measurements, and we want them obviously to document the nature of the therapy and your response to the therapy. So what are they looking for? Well, the carrier is looking for whether or not you've had Botox injections and your response to those injections. They're looking for use of and prescription use of oral medications, such as baclofen and other types of medication. And potentially they're looking for surgery, which could be a selective peripheral denervation type surgery or a deep brain stimulation surgery, DBS. Now, you are not required to undergo invasive treatment, but I will tell you that disability carriers will take your claim more seriously if you have that surgery, particularly if the surgery is not successful. Again, you can see it's really important that you're documenting your symptoms, how those symptoms impact your ability to function, the treatment you're getting, and the response to that treatment, and whether that response is temporary or permanent in nature. Now, I want you to understand that getting the disability benefits you deserve for cervical dystonia is not necessarily easy, particularly if the cervical dystonia is well controlled by Botox injections or medications. I'm also going to flip this on its side a little bit, and that is many disability policies or plans will have what's called subjective medical condition limitations, or they'll even have mental nervous limitations that will limit benefits in both instances to just 2 years. A disability carrier just might argue, if there's a subjective medical condition limitation in your policy or plan, that your cervical dystonia is subjective in nature. And I know that sounds crazy, even though there's a picture of your neck, fixed to one side, back or the front. They also may say, look, this just didn't come on overnight. You've had it for some time, and you've worked with this condition, and nothing has really changed. So you can see that there are a number of issues that are going to be raised in these cases, and particularly if you've had it before you are claiming you're disabled. It's really crucial that your medical records are documenting the nature and progression of the cervical dystonia, maybe changes in the range of motion, increase in spasms or muscle tone, increased physical therapy, that show a progression of your symptoms that help explain why all of a sudden, and it's not really sudden, is it, that you can't work and are applying for your disability benefits. You also need to make sure that before you stop work and apply for benefits, that you're looking at your policy to understand if there's a subjective medical condition limitation, because these limitations can be so broad as to include things like limited range of motion, pain, spasm, and disability carriers are inclined to try to argue benefits are limited to just 2 years. You want to know that, obviously, before you stop work and apply for benefits, so that you can speak with an experienced ERISA disability attorney, such as myself, so that you can be planning how you need to make the documentation, if you will, that needs to be in the medical records, the history, the diagnostic studies, the symptoms that perhaps will get you out of a subjective medical condition policy limitation argument. So again, you can see this isn't particularly easy, though in my view, the condition is dramatic and is often disabling. Got it? Let's take a break for a moment.
Been robbed of your peace of mind by your disability insurance carrier? You owe it to yourself to get a copy of Robbed of Your Peace of Mind, which provides you with everything you need to know about the long-term disability claims process. Request your free copy of the book at caveylaw.com today.